Don't wanna be an American idiot.
Hi, it's Loney here on 700 WLW. Local mask mandates reemerging as the Delta variant of the coronavirus continues spreading throughout the United States. We're seeing infection rates go up, hospitalization rates go up. Starting today, right now, St. Louis is the latest city to adopt new public health orders requiring people to now wear masks yet again in indoor public spaces. History is repeating itself, and you have to wear masks in St. Louis whether you're vaccinated or not. And there's law enforcement agencies saying we're not going to enforce this. So with so many Americans fully vaccinated, what do you sense the outcry is right now towards moving towards a mask mandate? The CDC doesn't want to do this for obvious reasons, but are we going to see this in areas like Cincinnati, for example, soon? Patty Olinger, let me get a different voice in on this. She is the executive director of the Global Biorisk Advisory Council, deals in public hygiene and disease control on the public level. Patty, good morning. How are you?
Good morning. I'm doing well. And you? I'm
doing fine. Thank you. The problem is this, you hear this and go, there's no way I'm going to wear a mask again. And I think most people who are vaccinated did what we're supposed to do feel that way. But are we going to see a mandate either federally or at a citywide level? I mean, do you see a day where Cincinnati, for example, is asked to do what people in St. Louis are, and that is return the masks? I don't see it happening.
I think it's going to be very difficult to now go back. Had they released or say gradually, progressed forward, that would have been different. But people are tired of being told to stay home and wear masks, unfortunately. But think about this for just a minute. I mean, everybody hears about the vaccination, and those of us who are vaccinated, we see that. If you go out in public right now, what you see is that you would, according to the guidelines, if you are not vaccinated, you should still be wearing a mask. Mm-hmm. And I don't know about you, but in public places, I see mostly unmasked individuals, which, so when you think about this, if you have 1,000 people and they represented the United States as far as our vaccination rates, which we're better than most countries, that's be around 50%. Mm-hmm. So that means that 500 people are unvaccinated and 500 are. Yeah. Of those 500 that are, there's going to be a certain percentage that the vaccine just didn't take, okay? Mm-hmm. For whatever reason. Maybe, just it didn't take. Mm-hmm. And so let's say that was 10%, because we know our efficacy rates are between 85 and 95%. So that's another 50 people. So in that 1,000 people in that place, most people are unvaccinated yet. We're not at herd immunity. And so that's why we're starting to see, as people are starting to go out without masks, we're starting to see those numbers start inching up.
So here's the issue, I think, too, is the people who really should be wearing masks are the ones who aren't listening to the CDC. And then you also have this. Those of us who followed the rules, we got vaccinated, we did what we're supposed to do, we wore the mask, hand sanitizer, didn't do anything for a year and a half, are now being asked to, get masked again. I'm not doing that. I'm done with it. It's over. And the people who don't want to get the vaccine are never going to get the vaccine. This is reality. Why are we going back to masks?
I think that what they're seeing is that, well, there's two things. One is that to get a handle on these rates going up, we've got to be able to do what we potentially can do, and masks are one of the areas that, one of the things that everybody can do to start bringing those numbers back into control. Mm-hmm. The other thing that I think was a mistake is that no questions asked. We know that the most likely way that you're going to get infected is by airborne. We also know that there is a percentage, we don't know what that percentage is, that can be transferred via surfaces. Even though, the CDC has backed off on that a little bit, we know that there is a percentage, but we don't know what percentage is. And so making sure that places are, cleaning those high touch points. Yeah. And then also, washing our hands, having that alcohol hand sanitizer available, and getting vaccinated is the way to get out of this.
Well, you just said the last one, right? We have a solution for this. It's called vaccination. We didn't before. That's why I had to wear masks. It's like, okay, I got my vaccination, and now as someone who's vaccinated, if I lived in St. Louis or L.A. or wherever else it might be, I'm now being asked to go back to wearing a mask. And the people who don't want the vaccine don't care about wearing a mask or get the vaccine. We're done. This is over. There's nothing more that can be done. Would you agree?
Well, it's one of those things where, from a public health standpoint, there's that, I don't want to say gray area, but there's that buffer area where, there are things that we physically can do, like wearing masks, washing our hands, cleaning surfaces.
Yeah.
And then there's that while we are trying to get people vaccinated, and I think we relaxed things a little bit too soon before we had that herd immunity percentage for people being vaccinated. So we still have to get people out there to get vaccinated. I mean, that's
right. But my point is this: is like we waited to open things up too long. I think you would have had a mass revolt if we were still on the lockdown phase right now by people who've already got vaccinated, because the people who don't want it are the ones really holding this whole thing up. And at that point, I think right.
Yeah, you're right. I mean, at some point in time, then it's, and we're starting to see this where businesses are saying, if you want to work for us, you have to have that vaccine. Or if you can. There are always medical reasons why you can't.
Right.
And then there's also, I've seen, different events where they say you have to show, your vaccine. And then as we open up to international travel, we have to recognize that people coming into the United States are coming from countries that don't have the vaccination like we do.
Yeah, when you travel internationally, absolutely. There's many countries that, I think almost all countries require you to have some sort of immunization or a card that shows, especially if you're traveling to and from areas like Africa, for example, that you have to have immunizations for some very specific things there, so we don't spread it around the globe.
Yeah, that's that infamous, I have one, the yellow card.
Yeah, yellow card, yeah. Right. So you need that if you're traveling these areas. So there's nothing new there. That's fine. But domestically in the United States, that's never going to happen. They're not. I think the other thing, too, Patty, is that, and maybe you know this, maybe you don't, how close are we to having a test to find out if I already have the antibodies? I mean, what about people who got it who really weren't all that sick but still have the natural antibodies, which are as good as the vaccine? Why aren't we pushing that?
There is a test that you can go to your healthcare provider and ask to have your antibodies tested, and but that comes with a cost. And I think that when you start looking at the number of individuals, that would be very expensive to have everybody have those antigen tested or antibody tests done.
But that would be the only way, I think, to show who's had it and who's because I think the numbers are far higher than indicated. Okay, I have the vaccine, but what about people who got COVID, didn't realize it, or didn't feel that sick, or didn't have to be hospitalized that have natural immunity from this? They should be factored in as part of the herd immunity as well. Oh,
that is, you're right. There's going to be a percentage of individuals who had, the symptoms are cold-like, mild flu-like symptoms. For those who had mild cases. And so you're right. They didn't realize it. They thought they had allergy issues or I just have a cold, so there is going to be a percentage. What that percentage is at this point in time, we don't know. It probably will be somebody's research project will be out there looking at that.
I hope so, too. The other thing, too, is that the burden of proof is going to have to be on those who don't want to admit people or allow people in who they don't know are vaccinated or not. And as you mentioned, there's a substantial cost. I don't know if it's substantial, but there's a cost, obviously, to do the antibody testing. So let's say I wanted to have a festival and go, okay, but in order to come to the festival, you have to have had the vaccine. You have to have the antibodies. Well, how am I going to know that? Well, I'm going to have to, out of my own cost, pay for antibody testing at the entrance site. And if you test that you have the antibodies, you can come in. If you don't, you're not allowed in. But who the hell's going to be willing to do that? You have I think, an unpaid mandate here, if that's the way we're headed. Somebody's got to pick up the tab for that. Is it going to be businesses? I don't see that happening. Eventually it'll be on the consumers. Or is it the United States government and the CDC? It's an unfunded mandate if we move in that direction.
It would be an unfunded mandate. I think that what you're going to see in some things, and we're seeing this already in events where they have, there are different agencies out there that will provide you with a secure, what they would call passport testing, where you can log your vaccine card. You can, if they require, let's say, some type of testing, the positive, negative testing beforehand. I've had to do that. I've had to show my vaccine card before. So, you're going to see that. And the biggest issue there is privacy. And there are some programs out there that are starting to come forward where you can have all that information, kind of like a passport, available.
Yeah, nobody's going to do the passport, though. I don't, and trying to force that on people, I don't see that as being plausible either. It's not going to. If there's resistance to people not getting the vaccine or wearing a mask, you certainly as hell not going to be able to pull off a passport.
No, it's going to be very difficult. I've had one. I was at one event where if you didn't show that you were vaccinated and you had to be temperature checked and everything, if you didn't have everything in place, you had to wear a mask, and you would get a different colored band on your wrist. So, it's a different world right now.
Well, it is. I don't know. So Patty Olinger's on the show. She's the executive director of the Global Biorisk Advisory Council, GBAC, and she deals primarily with infectious disease control in a public setting. And now St. Louis, this one hits close. You hear about L.A. and the like, but, St. Louis, there are rivals in baseball, and we just played them this weekend and won 2 out of 3. And now St. Louis, which is not that far from us, is going into a mandatory mask order. And people here, you wonder, well, is that going to happen in Cincinnati, Ohio? It seems like it's spreading. We're going back to wearing masks once again, whether you're vaccinated or not. And I don't even know if that's enforceable at this point.
Yeah, I think that, from an individual standpoint, we have to step back. And again, this is, I've been an advocate of we can stay open. We just have to think about our situations what we're looking at. So from an individual standpoint, even if you're vaccinated, if you have family members, let's say I have a family member that cannot be vaccinated and they're a high risk to COVID-19. I may choose to wear a mask because I don't want to become infected and have mild symptoms and bring it to that family member. And so you've got to look at your own situation, know where you're headed and where you're going, and understand that. You get onto a crowded elevator, and I've been on a crowded elevator. I had my mask on, and somebody sneezed, and everybody kind of turned around and looked.
Right. Not good.
Not good. So think about those situations. And then also, if you own a business, do not stop taking care of the high touch points. It's one of those things that what we're hearing from people, and they do surveys, is they're paying attention to what people are doing. How are you providing care for us?
Right.
And the other thing that we're seeing, which is very interesting, is that it's not just COVID that our practices and what we've done this last year has really been affected. Our flu numbers were way down. Staph infections were way down. Other things were really negligible or just completely decreased by some of the things that we were doing this last year, which is a good thing. Yeah,
that's a good thing. All right, Patty Olinger at the Global Biorisk Advisory Council. Thanks again for coming on the show. Have a great Monday. Appreciate it.
You too.
Take care.